Very good morning to all of you. First of all, I would like to thank AIO Society for giving me this opportunity to speak on this particular topic. So my topic for today's presentation is new presbyopic EDOF lenses, our experience. Why our experience?
1 minute, sir. Switch on the timer, please. 7 minutes. Okay. Okay, sir. Thank you, sir.
So why our experience? It is because of this gentleman, Dr. Rajesh Tiwari. Dr. Rajesh Tiwari, he is associate professor in Department of Ophthalmology in Subharti Medical College, Dehradun. I want to thank him. He is my mentor, he is my guru. And I want to thank because of two reasons. Number one, he introduced me this lens in my clinical practice. With the result, I am able to give good quality of vision to my patient. Prior to this, I was a simple phaco surgeon putting only the monofocal lenses. So thank you, sir. Secondly, Dr. Tiwari has contributed a lot in this presentation by giving his clinical data. So there is no financial interest in this presentation. So you know the cataract surgery, the refractive surgery, and there is more expectation for the spectacle independence after the cataract surgery. So there are many ways by which we can correct the presbyopia. We have the multifocal IOL, newer extended depth of focus EDOF IOL, which I'm going to talk about, and accommodative IOL. The EDOF IOL, it improves the range of vision without splitting the light rays, and it has no diffraction of the light. In multifocal lenses, we have 2-3 foci. With the result, there is blurring of the vision at some distances. But EDOF lens has the unique property known as the pseudo-non-diffractive property, beam property, and it helps in formation of elongated focal length. With the result, there is a formation of a clear, crisp, sharp vision at every distances, close to face, near distances, intermediate, and the distance vision. So what we expect after the cataract surgery, we need good vision at various level, at 33 centimeter, at near vision 40, intermediate vision 66, and distance vision more than 2 meters. So what we are doing after putting the intermediate lenses, we are more and more concentrating over the intermediate vision. We have the various types of the EDOF lenses, pure EDOF lenses, spherical aberration-based EDOF lenses utilizing pinhole effects, hybrid refractive IOL, and I'm going to talk more about the lucidus lens, hybrid diffractive IOL, and hybrid refractive IOL. So these are the various designs of the various EDOF IOLs. So there are certain differences between the multifocal and the EDOF lenses. EDOF lenses has slightly extra edge over the multifocal in the sense that it doesn't have halos, glare, and the contrast sensitivity, it is maintained in all the normal ranges. So this is the lucidus lens, which I'm going to talk about. This is the lens which is having the two surfaces, two zones. The center 1 millimeter zone, it is aspheric zone, which is meant for the near and the intermediate vision. The peripheral 6 millimeter, it is a refractive surface, and it is meant for the distant vision. So they are the various ranges. We have the ranges from +5 to 30. We have the toric platform also, and this lens is UV protected, and it's a hydrophilic acrylic material having the 26 photon content. The only drawback of this lens, this is a hydrophilic lens, it's not a hydrophobic lens. We cannot say about the occurrence of the PCO in future, how it's going to behave. So this is the dual lens. You can see that there's a specific design in this lens. In contrast to the routine monoocular lenses, the haptic design is slightly bulky, it is slightly larger, and they say that it fits very well in the capsular bag, and especially for the toric lenses, the migration from the intended axis is very less and very minimum. So we used to do detailed anterior posterior segment evaluation. The most important thing, in premium IOL, we take consent in Hindi as well as in English. So this is the consent form, and then it's written clearly there that about 80 to 85% will not require any glasses for any distances, but the remaining 10 to 15% patient may have the glasses for any distances. So including criteria for our study was the strong motivation for the spectacle independence after the cataract surgery. Age is more than 50 years, and the corneal astigmatism is less than 1 diopter. The exclusion criteria, the most important thing, a very high expectation of the patient. If it is there, then we should try to avoid putting the EDOF lenses or the multifocal lenses in those patients. The ocular, we have the age-related macular degeneration, uveitis, Fuchs endothelial dystrophy, advanced diabetic retinopathy, macular scar, and enlarged glaucoma. So this is some small video. The routine phacoemulsification is done. The most important part in the surgery that once we remove the viscoelastic from behind the lens, try to avoid touching the center part, which is very sensitive for the near and the intermediate visions. So coming on to our clinical data, the duration of the study was from March 22 till date. We have operated 54 eyes, which were followed for 3 months. In 12 eyes, we operated bilateral implantation, and the 5 eyes got the toric IOL. So preoperative vision was ranging between from 618 to 660, and these are the results. After the 1 month of the surgery, the most of the patients, roughly about 52 patients, they got 6/6 vision, and in the remaining 2 patients, we have to give glasses for the distance. Near vision was also excellent. After 1 month, the 50 patient doesn't require any glasses, and for the near vision, and we got N6 vision. The most important thing is the intermediate vision. So this, I personally calculated the defocus curve for evaluating the intermediate vision. The visual outcome of these lenses depend upon the intermediate vision is there. The result of the operated eye is also excellent. After 1 month, most of the patient got 6/6 vision and N6 vision. The other important point in the EDOF lens is that the symptom of dysphotopsia is very less. In our patient, at 7th day, we have some glare and halos in about 4 patients, but after 1 month, no glare, no halo, no star, but was seen. So friends, seeing is believing. Why? Because I have personally plotted the defocus curve for these patients, and the results were excellent. The results were very good in bilateral implanted EDOF lenses, where the intermediate vision was seems to be good. But if you plot the defocus curve for the multifocal lenses, there is usually a double hem type of defocus curve is observed. Contrast sensitivity is also very good. By the end of the 1 month, about 48 eyes could read up to the 1.85 to 2, which implies good contrast sensitivity.
Conclude, sir. Yes, sir.
So I conclude by the EDOF lens. It's a good option for correcting presbyopia, especially for the intermediate vision. In addition to the distance and near, there is a minimum of the no dysphotopsia. But remember, IOL implantation doesn't ensure 100% spectacle independence. Thank you so much.
Thank you, Dr. Harsh, for that excellent presentation.